Hi everyone! Today I will be demonstrating how to take vital signs on a pediatric patient. Let's begin. In vital signs taking of an infant, first thing you have to do is perform hand hygiene. After performing hand hygiene, be sure that all your materials are complete. You should have thermometer, a watch with a seconds hand, alcohol swab, and those cups that you will need. If it's for infant, this much is small, and for the pediatric, this much is small, and for adult, this big. So in performing vital signs, there should be a pair of parameters that you will take. First parameter will be the temperature by using our thermometer. Then the second is blood pressure by using our sphygmomanometer. Then third is pulse rate. And then fourth is the respiratory rate that we will check for the respiration of the baby. After checking all the equipments that you will use, if it's all functional, taking vital signs of a pediatric patient, all we need to do first is tell the family who you are, introduce yourself, tell them why you are doing the procedure, tell them what can you help them, ask them the history of the patient, ask them also why they visited your clinic. So it's gonna be like this. So let's start. Good afternoon, ma'am. I'm Erica. I will be the physiotherapist of your baby. And by the way, what is your name? Amira. Oh, that's a beautiful name, ma'am. So for today, ma'am, I will start the treatment for your baby. But before we start doing physiotherapy, I need to take the vital signs of Amira. So let's proceed first in the room for vital signs taking. So now, place the baby on the clean surface or the clean area where you will take the vital signs. Before we do the vital signs, check for anything with the mother first. Ask her about the history of the patient. So, when we start doing the procedure, we already asked the mother why they went to the clinic. The mother already informed me that the patient had delayed motor development. So, before we start the procedure of physiotherapy, I will do the vital sign first. In doing vital sign, for my pediatric patient, I will start with the thermometer. So, I will take her temperature first. So, there are ways of taking temperature for an infant. First way is for through axilla using a clinical thermometer, or another way is through rectal. I'm using a clinical thermometer here. So in using clinical thermometer, be sure that the mercury is on 0. Not on 0, just tap it like this until it went to 0. Now it's on 0, and we use the rectal thermometer. In doing rectal thermometer, all you need to do is first you have to clean the thermometer with the alcohol swab from bulb to tip. After cleaning the thermometer from bulb to tip, we need to put a petroleum jelly and insert to the rectum of the baby. That's rectal way. But in this case, I will do axillary. Okay? So, first, I will raise the hand of the baby this way, insert it to the axilla, then bring back the infant's arm. Then I will ask the mother to hold it for me, or I can hold it with the other hand while waiting for the thermometer to be finished for around 2 minutes before we check the temperature of the baby. Now we will proceed to pulse rate. How to take the pulse rate? All we need to do is locate or palpate first the brachial pulse of the baby. Where to find the brachial pulse? It should be located from armpit and antecubital fossa is your landmark, and between the antecubital fossa and the armpit, you can locate the brachial pulse. So you can count using a watch, or another thing, if it's infant, it's better for you to use your stethoscope. Be sure that everything is already sanitized. So now, when you put the stethoscope, all you need to do is be sure that the orientation of this one will match the orientation of your ear. So it's gonna be like this, going in. So I will put now on my ear. Then, before counting for the pulse rate, all we need to do first is don't forget to throw your garbage on the trash bin. All you need to do now is hold this small hole this way, so that you will not hear anything except for the pulse rate of the baby. So you can locate or put here in the sternum, in the middle of the chest. Then, while listening to the pulse of the baby, while counting, you can check the rise of the abdominal for counting for respiratory rate. Okay? After 60 seconds or 1 minute, pulse rate and respiratory rate counting should be done. So after that, again, you have to clean your stethoscope that you use. Now, clean it. After cleaning the stethoscope, if still have time, you can start with your blood pressure. So after putting the cap, all you need to do is here again for the systole and diastole. The systole is the first beat and the diastole is the second. The systole is the first beat that you will hear when the pulse get back, and the diastole is the when the pulse get normalized. So we will start listening to the beat. Then always your index finger, not your thumb, because thumb has also another pulse. So use index finger, touch the toes. Yeah, this way. After that, take this one. Be sure that it's close. Then pump. Then put until 100 millimeter mercury. Then release the valve here. Okay. When releasing, slowly. Then after taking the blood pressure, you can already now check for the thermometer. Then, before reading, clean first the thermometer. Now you have to clean from the tip going to the valve. Okay? Then you can read it. Okay? After reading it, note or record what you read for the temperature. Record the temperature. Record for the pulse rate. Record for the respiratory rate. And after recording all the things and for the BP, then clean all the equipments that you will use. Do aftercare. And after doing the aftercare, always never forget to perform hand hygiene. Never forget to do hand hygiene. And after that procedure, you can already go on to the next treatment. That's all. Thank you. Remember, after a task, never forget to do aftercare and perform hand hygiene regularly before and after doing any task. Before I end this video, I just want to share something. If you want to increase your earning, you have to keep learning. And when you keep learning, you know something that gives you an edge to others. That will comes with the knowledge. So, learning is important. So, just keep learning, keep improving your life, and keep studying, keep going on to your dreams. Keep fighting on it. That's all. Thank you. By the way, don't forget to click like, comment, and subscribe to my channel. Thank you.